My name is David. I'm the technician that's going to be helping me out today. I saw that Nemo's coming in for a quality of life exam today. See how she's doing at home.
So if you don't mind, it's not because I'm recording your voice. I just want to get some.
Of course. Yeah, no, I totally get it.
So he's definitely his daddy's dog.
Yeah, and it's definitely something I have to feel like it's the time or... I mean, he's 16 years old. And he has his moments. He's got a growth on his ear. So, hey.
And he hears Nemo.
And he doesn't see all that well.
Other than
the loss of hearing and vision, okay. And I can see the back legs, hips are sort of bothering him as well.
Yeah.
Yeah, his back legs do a strange tango that are not in connection with any other part of his body.
Gotcha. No, gotcha. Alrighty, and what other concerns do you have at home? Has that growth been tested at all yet, or?
The growth on his ear, there was a blood test done. She couldn't tell us anything much about it.
She didn't want to do it on the growth because she wasn't. That would mean it would.
She didn't know what.
Excuse me, just a second. She took a blood test from another part, like his leg or something. So it was a generalized.
Okay.
She didn't think he would survive doing the blood test on the ears on the thing itself because he would have to go under, and she didn't think he'd survive that.
Okay. Sure.
And that's the vet
that
from
may
the
be
Humane
so.
Society.
Okay.
That may be so, but he, yeah, we try all kinds of things to, it kind of just weeps a little bit, weeps blood a little bit, and, but anyway.
Has he been eating, drinking, using the bathroom okay at home? How's that been going?
Oh, yeah.
What?
He poops okay and pees okay and
But he tends to sit on it,
has a
I
tendency
tend to-
to collapse his legs out from under him, but,
and so I just kind of support
but
him.
if I support him, he poops okay.
Okay.
They're not messy, they're not,
No,
solid.
yeah, they're solid. They're little Tootsie Roll things. The other day he usually averages 5. The other day he did a full 13, which was really odd.
Yeah.
He's going, that's good. And he's been eating okay?
Now that's not a
Yeah.
problem.
He eats. I'm surprised. I would think, technically, if he
Yep.
at any other
And
time,
now
he
we're
would
dragging
be a
the-
little weighty, but he eats pretty well, but he's not gaining a whole lot of weight.
Okay.
You know, so
Well, we'll check in on that today as well. And is he on any current medications or supplements?
no, he's not on any medications or supplements.
Well, you don't give him. What do you? Don't you
give
give?
him liver treats? That's what he gets, just like these right here.
All right. Those are the good ones. I feel like most of the dogs that come into the clinic are always a big fan of those ones, so I can tell he's getting fed well at home.
Yeah, we
And
buy them,
we
buy
tend
them in
to
big
keep
bags.
him less.
We have 2 dogs.
We were told by the vet that used to be up on. I mean, it's up on. Well, it's 33rd. It was Mill Creek Vet. We knew the doctor, Eric Foster, but
And he was our vet for years.
for years.
And then
He sold
out, and
retired, and then he died recently.
the new
And-
vet clinic, new vet clinic, and the whole thing are just not quite the same.
No, she didn't even remember that she'd said anything about him having a problem with poultry. She didn't know why we were doing it.
Yeah, they were the ones that told us not to feed him
Poultry.
because it created an infection in his ear.
Okay. Sort of an allergy
Yeah,
to the poultry.
and so
Okay.
they said not to do that. So we've only fed him primarily beef.
Although I do find that
Um,
all the beef products have a little bit of chicken in it.
yeah.
All of them.
Yeah, it's
So, but we try to keep him pretty much on that, and
And one that has some pretty good vegetables in it too.
He eats twice a day. He sleeps and sleeps, but
No.
And if he
That's
gets
what
up,
dogs
it's a
do
good
anyway.
idea to get him outside.
Right. There we go. Okay, perfect. Well, I'm happy to hear that it sounds like he's eating well. I know that you noted the sort of hearing his vision lost a little bit, and that his back legs seem to be struggling.
Neville.
Um,
Yeah, nothing.
that's not Neville.
Oh, that's not Neville. Nemo. See, we have Neville and Nemo, and they both start with this
Nemo.
first two, and they're
Yeah.
about the same size.
Nemo doesn't hear very well at all, but
Nemo, Lou, no.
but he knows I'm there.
right. He's got a good nose, doesn't he?
Yeah, he's got a good nose.
He sleeps with Daddy, and I sleep with Neville. And Neville's definitely an under the cover because he's part Mitty Dachshund.
These two are just adorable. I wish I was able to meet Neville too, but
Yeah,
awesome. So
Well, Neville's younger, and
yeah,
Whatever,
he's 11.
I'm glad I get to meet Nemo today. Then, if it's okay with you, all grab him and just try to grab a quick weight on him.
Oh.
yeah, he won't do anything. Just
No, I'll just be extra careful.
he's good.
Hi, buddy. Oh, you are sweet. You are sweet.
Here you go, bud.
Alright, good job, buddy. Alrighty, about 13 pounds even. Awesome. I'll just feel the heart rate. Awesome. I'll just put him back down here for you.
Oh, yeah, already we're done. See, I told you weren't gonna have all that problem.
Good job, buddy. Alright.
Yeah, thanks.
I can't. My problem is that I can't bring myself to feeling like I need to put him down.
Yeah, no, totally. I'll Dr. Bobby do sort of an extensive exam, make sure, see what he thinks, and then we can sort of go from what he says
Right.
from there. But just gonna go into it like a normal exam, see what we find. But I'll mention the growth. You said it's on his left ear or right ear?
It's on his right ear. You can see it. Just flip
Oh,
his
yeah.
ear up.
Gotcha. Alrighty.
Yeah, it's really there.
It's
I've
there.
Yeah,
I've never seen that before.
And
on any
he
animal.
puts a little netting on it a lot of times at night and stuff, so that
Sometimes
it.
at night I try to wrap it so that it doesn't bleed so much, and I keep his underneath his ear in that area pretty much shaved all the time so that the blood doesn't cake up. You know.
Right. Gotcha. And does it usually bleed from that area?
Yeah, I wash his ear twice a day.
Alrighty. Oh.
Yeah, and I've tried a number of things. I tried a liquid bandage for a while to see if that would help, and
Gotcha. I'll let
Yeah.
everybody know about the growth. And when did you first notice it?
it's been there for several months.
Several months, okay. And it sort
Yeah.
of grew rapidly in size, or?
Yeah, well, what happened is he had he gets these little
Skin tag things.
well, they're almost like there's liquid, little bumps, you know,
like
they,
the little cysts. Or...
yeah, type thing. And there was one on his ear, and that popped.
Okay.
And that's the return of
Okay.
what happened after that.
Gotcha. So after that popped and sort of when it did pop, I'm assuming it was like bloody, or was it sort of clear,
bloody.
yellowish?
It wasn't overly bloody. It was just wet and all of that. But as we went on, it started to get another bump, and then it just grew into this.
Okay.
From that.
Gotcha. And has he been on any current medications for that at all? Or, okay.
No, didn't know what kind of medications there would be, and
Yeah.
our old vet wasn't around, and the new vet didn't make us overly happy.
Right. Okay, gotcha.
The
Well,
old vet is the one who brought chiropractic into veterinarian work.
Okay, gotcha.
He was really,
That's super cool.
he was
Sounds
wonderful.
like a good guy, very smart guy.
He was
Yeah,
a
he
really
was-
good guy.
He was a great guy. He saw us through 4 animals.
Mm-hmm. Oh, that's awesome. That's
You
so
know,
At least, yeah.
And we had 2 dogs that had to be put down rather quickly. We had one dog that I absolutely loved and adored, and he all of a sudden was bleeding in the mouth and
Oh,
the whole
sorry
thing,
to
and
hear
they
that.
took him in, and Eric did a test on him and said his blood's not coagulating,
Gotcha. Okay.
Which
Which he
dog do you
said-
mean?
which he said
Do you mean
was a
Willa?
sign- Yeah,
Willa was a girl.
yeah, and he said, there's nothing that we can do. It's a cancer of some form
Okay.
that's happened with her.
And she was actually my daughter's dog.
Yeah, and,
Okay.
And
but she was so sweet.
and it was like her first day back at school.
Yeah.
And I said, she
Called her
can't, and we just said, Dad's going to pick you up as soon as you get out.
Okay.
You have to come
Yeah, Eric said we need to put her down.
today.
Not gonna make it.
And it's cruel to keep her in.
But,
So,
Yeah,
you
I'm
know,
sorry to hear
and we
that.
trusted Eric because he was always first off, he lived just down the street from us.
Right.
yeah, 2 doors down was
Yeah.
helpful.
He was just a great vet,
Right.
you know. And
Well, he sounds like a great guy, and I'm hoping Dr. Bybee will live up to those standards. But I know him personally, and I know Dr. Bybee's one of the smartest people in the clinic, so
yeah,
I
good.
know he'll take good care of Nemo. But is there anything else you'd like me to mention to him while I'm back there?
Pardon me?
Is there anything else you'd like me to tell Dr. Bybee while I'm back there?
No, we're just wait here and have
Perfect.
him come in and look and see what he thinks.
Alrighty, then
We'll work with him.
sounds great. Well, I'll go
Thank
have
you.
a quick chat with him then, and he should be in shortly to see you.
Okay. Come here. I think he thought his weight was good, and I think he thought that he was getting around okay. And so they take a paw print. Come here. Oh boy, Dad, does that taste good? Want to come up here? No. Hello.
Hello.
I'm Sean Bivey.
Nice to meet you. I'm Bellows-TerraNova, my wife Barbara.
Dennis.
Hi. Do you mind if I'm taking pictures?
No.
If I'm filming, I mean.
So,
And this is Nemo.
this is Nemo, and named after the movie.
Pardon me?
Named after the movie.
No, he
Nemo?
actually he came to us with his name.
Okay. Okay. So he's.
Now our other dog is named after the movie.
No, Neville,
Neville.
is a different, but he's got a long back, so he's Neville Longbottom.
So Nemo is
Shih Tzu.
16.
Approximately, we believe that
Okay.
we got him in 2010, and I believe he was born in February, so he's almost 16.
Yeah. Hey, bud.
Hey, come on.
And he
Can't hear very well.
can't hear well, and he's just kind of an old timer.
Yeah, he is just an old dog.
And his back end is
Well, yeah.
at least a bit wobbly.
So.
He has a growth on his ear, on his right ear.
Oh yeah.
We don't know exactly what that is.
Oh yeah. Looks not very happy, whatever it is.
Yeah.
Yeah, well.
And it
we try to
hasn't
keep
gotten
it
any
clean,
smaller, that's for sure.
And, you know, I wash his ear twice a day, so in the morning and at night. And, you know, he's gone bald like old dogs.
Yeah, his
You know.
spine is right there.
Yeah, and he doesn't have great mobility, does he? He can't really use his back
He
legs
gets
very
around. He's been
he-
actually really active here on the floor. He's
Well, yeah,
moved around. pretty
doesn't
well.
mean his back end has always been right
But,
under where it should be.
In the mornings, he's a lot better than he is in the evenings. Sometimes he.
We live in a split level with 6
And he,
and 8 steps, so there's 14
poops
steps to
pretty
do
well.
everywhere.
His
So-
legs kind of go out from under him. They aren't. His poop isn't mushy or anything like that. It's solid and.
Except when I have to hold
He
him up and he
drinks
kind of sits
well.
on it.
And eats well, and moves around. He doesn't do this kind of moving around very much at home.
No, he generally finds a place to be and plops.
And lies down, and he sleeps pretty much through the day.
When he does wake up and discovers Daddy might have gone to the bathroom, he starts barking very loudly.
Yeah.
And I'm probably downstairs,
He
and so I'm
doesn't-
scrambling
he doesn't
back
hear
up.
really well, but he definitely knows when I'm home, and he definitely, he's my dog. That's all there is to it. And that's the reason I'm having such a hard time thinking about putting him down, because that's. I don't believe that I think he's in any kind of pain at this point. But I may be wrong. I don't know.
Yeah, we don't know.
Yeah.
You said that he's eating okay.
Yeah, eating
he's
okay. Drinking okay. Drinks a lot of
Any
water.
diarrhea or vomiting?
No.
No vomiting.
diarrhea, no vomiting.
And no, not diarrhea. No, just kind of
He
sits on it a little
he
bit.
has like right here. You can feel this. Right here.
Yeah.
That's it's been there for come on.
He just sneezes. It's okay.
Hold still.
Yeah, he does have jaws of steel.
Well, how can I help? Ask another question is, what's your goal for your visit today?
To figure out whether or not it's time for Nemo to go to sleep and not get up again. My daughter and her husband thinks that it might be the time, and he does have a little mobility problem. He has some mobility problems.
He's doing a great pirouette.
And
Oops.
the growth on his ear is
At least he
kind of a
doesn't.
problem in
He
the
doesn't
sense
scratch
that
at it, thank God,
he
because it would.
doesn't scratch at it. And once in a while I'll try to wrap it, but that's not an easy thing to do at that point. I do keep him shaved underneath it really tight, so that if it does weep the blood, that it's not hard to get out, so that it doesn't mat into his. But you can see that he's.
Yeah.
For me, I'm a little concerned. They go out in the front yard, and there's a sidewalk from the door to the gate, and then there's the grassy area, and it's lower by nature, and a little wobbly. It's not real even, and I worry a little bit about sometimes that it might bother him, but he doesn't cry. He's just determined, and he keeps moving.
He seems to pee consistently that he ends up standing in it.
He's pee.
Yeah, it's just.
That though he doesn't have as good a control over. Not.
Or,
He'll just
for
go.
almost as long as I can tell you, he's never been a leg lifter.
No, he's a
always
squatter.
He's always been a squatter. And like I say, his poop is solid. He has consistent. It's not mushy or anything like that. He eats twice a day.
Yeah, I mean, it sounds like the major body systems are doing well. This is a hard thing.
Yeah.
And because so many times as dogs, as they age, their body starts to fail.
Right.
Yeah.
But their brain is still there. They recognize you. They eat, they drink, they pee, they poop.
Yeah.
And
Good.
what determines quality of life is different.
Yeah.
What do you think is a good quality of life for Nemo?
Well, he's never been a big runner. He's never been a big, he doesn't bark at other dogs. He's never been that kind of a dog. He's never been aggressive in any way.
He doesn't care about other dogs, essentially.
They just don't bother him, and they can come and stand next to him, and he acts like he has no idea that they're even there. But he doesn't see well, and he doesn't hear hardly at all, I don't think. But he knows when I come home. He definitely knows if I'm not there at night when it's time to go to bed. If I'm not there, he definitely knows that. And
Oh, he went out of town for 3 days, and Nemo did not stop barking.
yeah,
I
So
couldn't get any
Do you
sleep.
think that he has a good quality of life right now?
I don't think he has a great quality of life. I think he's okay, but that's just, that's me with 16 years under my belt with him, and my problem is that I'm just not, I have a really hard time thinking about putting him down. It really, I have feelings that he goes down and
And that you'll go
his little
down?
dog spirit is around saying, but why'd you do that? And
Yeah.
but on the other
It's hard.
hand,
It's really hard.
it's
I wish there was more of a signal of it
that
about
if he
pain,
doesn't die, I mean, my wish is that he would fall asleep on the bed and not wake up the following morning.
Yeah.
I mean, I had the experience just a week or so ago where he had been really, really restless, and I just stayed up and held him and loved him, and he finally fell asleep. And I just sat next to him for an hour, and pretty soon he was breathing rapidly and like this, but he was pretty much asleep, and then he got quieter and quieter to the point that I almost felt like there wasn't anything, that he wasn't breathing. And I even told my wife, I think Nemo is passed. But he woke up and barked a couple of times and said, no, I haven't passed yet.
Just dreaming.
And my problem is,
I mean, he used to chase
I get guilt.
my dog
I get
around.
guilt feeling over putting him down, and so it's It's
Why
really-
why would you feel guilty?
because I feel like, see, I think that he has a total consciousness of what's going on around him, and that he knows it's not a an absent. I mean, I think he loves when I come home.
Mhm.
He loves when I'm there with him.
Mhm.
He doesn't sit in my lap, but he.
And the way when Dennis is at work, because I've worked remotely, and at the moment I'm applying for jobs
Yeah. Anyway.
remotely.
Yeah.
I will help him settle down by putting one of the dog beds where he can see when Dennis comes in the back door.
Yeah. You know,
It's
and
like, oh, here.
he can't really see me, but he definitely knows when I come home. And I guess I just feel this. I just have this consciousness about me that thinks that he might be disappointed if I put him down. That he might be, why did you do that to me? You know, it's really, it's to the point that when he does die, I just don't think I can do another animal. I mean, I'm 76 years old. I think I'm gonna pass before another dog would pass, you know, and
We can tell that you love him very much. You love him very much.
yeah,
And
it's a tough
that,
one.
that anticipatory grief
Yeah,
is, it sounds like, weighing very heavily on you, and even thinking like, oh God, when he does die, the grief
yeah,
could be overwhelming. And that means like grief is just
I mean-
profound love with nowhere to go.
I mean, we'll still have Neville,
So,
and Neville will be right next to him.
Neville is her dog.
Yeah, and he is between us in bed.
yeah. So, you know, I think that this is one of the hardest decisions you have as a pet owner,
Right.
because you do have an animal through all of their life stages, and that's really magical. You know, of a 1-year-old rambunctious dog to maybe more relaxed adolescent adult dog to then a senior dog to now a geriatric dog.
Yeah,
You had him for his whole life, basically, and it'd be weird if you weren't attached.
yeah,
Like, this level of emotion is expected, and I'd be more worried if you were like, I'm done, I'm ready.
Yeah.
In a dog that's like this. Now, what I see is a dog that certainly has some chronic conditions, the muscle atrophy, the mobility, this mass. But I also see a dog that's walking around the room, interacting with you, with me. You said that he's eating, he's drinking, he's peeing and pooping.
yeah,
Maybe not always where he needs to get those things done.
yeah. We have those little
I would
accidents
say-
here and there.
Yeah. So I would say, based on this assessment of where you are and where he is, that you guys together are not in the right place to say goodbye today. That would be
Right.
my impression.
Right.
Correct me if I'm.
No, I think you're correct.
Okay. And the other thing is, when you're evaluating quality of life, which is really what we all want, right? We all want a good quality of life. We want
Sure.
that for our dogs too.
Sure.
And that is different for every single dog. You know, like Labradors, if they don't eat, that's like, whoa, their quality of life must be suffering if they're not eating.
Yeah.
You know, for other dogs, it's normal for them to skip a meal every once in a while. It just, you know, it depends. And so it's different for every animal. And what I would really encourage you guys to do is get a pen and paper and just write a list of, try to get 10 things on a piece of paper of what Nemo does that means he has a good quality of life. What do you think? So you mentioned a few that he likes to eat, he likes when you come home, he recognizes you. Like, those things can be very valuable as just little things to actually observe. And you can then say, today he did 8 out of 10 things on this list. Like, I still think his quality of life is good.
Yeah.
Or today he had a bad day, he only did 3 of them. And try to assign each day a happy face and a smiley, or a happy face and a frowny face, you know, and keep track of them. And if you start noticing that, like, oh God, the past week he had actually only 2 good days, 5 bad days, I thought it was more than that, because we always hang on to that, like,
Yeah.
that hope, and that, you know, we hang on to the positive things more than the negative things sometimes in this kind of situation. And I think it'll give you a little bit of an idea once those bad days start to overwhelm the good days,
Dennis, I can
that his
share.
quality may not be great.
Yeah, it's, I know that he's old, and I know that he's probably even old for his breed. You know, the vet that we were seeing, that owns Mill Creek now, or I think owns Mill Creek if they haven't sold out to a corporation. But,
Well, he is a corporation.
but
That guy, because he's got one up in Park City, and
yeah, yeah.
he's got a few.
And he has a Shih Tzu, and he says, yeah, my Shih Tzu's 14 years old, and he can't see me and he can't hear me, but he comes and lays right down next to me, and he's telling me that as a vet, he has a hard time thinking about putting him down.
Yeah.
You know, but
And
he
we're all human,
also,
too.
but he also said, you know, he's at that stage, and today he's moving around really well, and in a week he may not be moving around really well.
Yeah.
But
yeah.
As long as he's in this status, it's really hard for me to go, okay, let's do it. You know,
And it isn't making our life work.
you know,
Hard.
it is, and this has been kind of the situation, because my kids think that, Dad, you should let him go, and I keep thinking, okay.
Well, and
deep
there's-
breath, and
there's-
do that, and
And
just-
basically, the only ones who really, I mean, Ava's the only one who's stable with a pet.
yeah, and,
With her pets.
and, you know, he doesn't move this much around at home.
No.
He comes over, climbs into his nice soft little bed, and he falls asleep, and he sleeps. But then he wakes up, and I can pick him up, and I take him outside. He can't go up and down the stairs like he used to, so I carry him up and carry him down.
Yeah.
But I can
And
take
there's
him outside
stairs
and
up
set
to
him
the
down.
bed.
I can take him outside and set him down, and he'll walk around a bit and the whole thing, and do his peep and his poo, and you know, and then when he's ready, he comes over and barks at the door, and I come and pick him up and
Yeah.
bring him in.
So, yeah, and I think for a lot of people with dogs specifically, the ability for them to like emulate and get around their environment, and to pee and poop where they need to,
Yeah,
is one of those major quality of life things.
right.
But then for other families, it's like, well, I'm fine taking them up and down the stairs. That doesn't bother me.
I mean,
You know,
he
he's-
has-
'cause
I have to go up and
Because-
downstairs
Because
anyway.
he's only, he's only 13 pounds. So if he was 80
Yeah.
pounds, like you wouldn't be able to do that. But so that's just one of those things that you may need to put on the list and like, well,
Yeah.
I'm fine doing that. Like, it's fine.
Well, if it gets to the point to where he really can't go outside, or he's peeing and pooping
Well,
a lot in the house, and it's soft and it's mushy and it's.
We'll see how
Then
it
I
goes
know-
as it
then
gets
I know
cold
that
and
things are
snowy.
really coming unglued.
Yeah.
His ear growth, I try to figure out ways to keep it clean and to keep it from bleeding and that kind of stuff. It does bleed. I do keep him shaved down below his ear pretty much.
See, now
So
he's
that-
stopped walking because he's probably tired, and now he's
Yeah.
starting to shake.
You know,
I think he's just getting
and
anxious.
And he
well,
doesn't shake at home, but he's just nervous, you know.
He was shaking all the way all the way. He knows when he gets in the car and Dad's holding him.
Yeah.
We're going someplace, and I don't know.
He's gonna tuck her out and fall asleep when he gets home.
Oh, he'll be,
So,
yeah.
yeah, I mean, I think that it's hard,
Yeah.
you know, and as much as people want me to be this role and be like, yes, you have to do it.
Yeah, no, I don't want. I want
that's
somebody
not-
to tell me.
That's not my role. My role is to kind of educate you on how you can make the decision that you are
Right.
peaceful.
And very much appreciate
And
that.
that's my. and that's always been my thing. I wanted somebody to look at him and, you know,
Tell me if he's suffering.
If he was really having a lot of problem, to tell me, you know, he's, from my experience, he really is having, you know, too much
Whoops, you're
problem
sitting.
that's making things going. But I have a hard time thinking that if he's mobile this much, and he doesn't act like it, he's
He's
hurting.
going to be exhausted tonight.
Yeah, but it doesn't act like, to me, it doesn't act like he's hurting.
Yeah.
And I don't know, that's the other thing about that, is
Yeah.
that I don't know what happens when it really starts to hurt. They
Yeah.
just don't move, I think, is,
Yeah, and I don't know if the way he's walking is definitely abnormal.
right,
And what I can't tell you is this nerve weakness that's non-painful,
yeah,
or is this like a disc herniation or painful conditions? Like I pushed on his back a little bit and he didn't react, but he's worked up and anxious, you know. Like
Yeah.
he could be painful and just not reacting. So again, this mobility just is another factor for his quality of life. You know,
Yeah.
like again, for most people,
He doesn't cry or
for
snap.
most,
And
for most people, if their animal cannot get around the home, then that's like one of the major
sure.
poor quality life indicators.
well, right, but I couldn't pick up our German.
But
We had a German Shepherd that
but if you
lost
guys
her.
if you guys are like, yeah, I'll carry him around, like that's fine by me,
Yeah,
then that's great. But I would say that you know, as a dog, if I were to be in his shoes, like it's got to be kind of frustrating not to be able to do that.
right.
You know,
And if the
and that's
ear
like,
thing just
in the ears, there's like no solution for that. Honestly, other than
Right.
removal, which is not on the cards. Not on the,
Well,
right, but
and
if
I
it
thought
gets,
that maybe
if
there
it,
could be something done medically, and the other vet said that she didn't think that if he had to be put under anesthesia, that he would live through it. That,
it
you know,
would be a lot for him.
yeah,
It'd be a lot.
and
So, yeah, I think it's hard.
yeah,
And I do want to give you, maybe permission's not the right word, but it's okay to say goodbye when he's feeling good,
yeah,
rather than waiting until he's absolutely not.
yeah.
Well,
Well,
I'll share with you one short little anecdote. This was a long time ago. I had a feline patient on my schedule for euthanasia. I'd been working with them for a couple years beforehand. The cat had kidney disease, and they were on the schedule and they canceled. And I called them and they said, "Oh, I've forgotten the cat's name by now." I'm like, "Oh, she's feeling better. She's great." I'm like, "Okay, great. Let's stay the course." And then a week or two goes by and they're on the schedule again, euthanasia, and then they cancel again. And again, I called them and I said I was checking in, and they said, "Oh, like she had a couple bad days, but she's good now." I'm like, "Okay, great." And then the third time they're on the schedule, they showed up for the euthanasia. This cat was quite old, and I walked into the room expecting to see kind of this poorly responsive cat, and it was a geriatric looking cat, but she was alert and looking around. And I asked, "She must be having a bad day," and she said, "No. So actually, yesterday and today have actually been really good. She was outside, she pounced on a butterfly, she ate a little food, but I just know that it's not going to last. And
Yeah.
I'd rather my cat have a good couple of last days, pouncing that butterfly, eating that little bit of food, rather than waiting until she cannot recognize me. She's sick, she's ill, she's not
and that's
moving."
kind of how I feel about it too.
And that was one of the things where I was like, it's okay.
that's almost like a fantasy. I'm chasing butterflies and I'm having fun.
It's okay to say goodbye on the last day. I mean, one thing I can say for sure is he's not going to get any better.
No, we know that.
Yeah, he will continue to decline in mobility, and who knows what his kidney function is and all that. We haven't even talked about that, but there may be like things where he just like suddenly is super
Yeah,
sick, or he'll just gradually lose more and more weight. Appetite's gonna go down.
I'm
and-
not expecting Nemo to live even another 6 months. I'm really not. I'm expecting that in the next month or so that he's really gonna get to where the time comes that he's.
Well, and I think what
It's
he
just
was
not-
saying,
It's
if,
just not good.
wait, when did the stranger come into the room?
And he's this is his favorite. Hey. It's his absolute favorite.
Is that the liver?
Yeah.
Yeah. So yeah, it's hard.
You know, I know that he's going to get to that point, and I don't want him to suffer in any way. I don't. My problem more than anything else probably is me. You know, more than everything else, it's probably just me saying, I don't want him to go. I want him to stay. I want him to be here, but I don't. But I don't want to push it. And you know, maybe in 2 weeks I'll feel differently because things will change. You know,
Tomorrow,
and
you could feel differently.
yeah,
And you know, I think a question that could be helpful to ask yourself is, 5 years from now, will you have any regrets
yeah. Well, that's
on like, I said goodbye too soon, or I kept him around too long for me, and he was showing me visible signs that he wasn't doing it.
I'll tell you this story. My first dog was a Dalmatian when I was a young kid, and name was Spot, and he lived to be 15 years old, 16 years old, and he was in pretty good shape, but he got into a big fight with the collie down the street, and they really tore each other up. Spot and Teddy just went at it and just tore each other up. And at that time, there wasn't veterinary clinics like there is now. That was back in 1960. And
60.
you know, we didn't have a vet as a family. So I called at that time the Pound, humane. It wasn't the Humane Society even. It was the Dog Pound. And Spot was a really smart dog. We used to laugh and kid about the dog catcher coming around wanting to see if they could catch him, you know, and I could say to him, Spot, go home. No matter where I was, I could say, go home. And he would take off, no matter where we were, and he'd go straight home. You know, and he was a really, really good dog. But when this happened, I saw that I felt like he was hurt. So I called the guys, and they came and got him. And I remember seeing him and I still see him in my dreams, that he was in the back of the truck, and he was looking at me as they drove away. And stop. And to this day, I have this feeling like he was saying, what are you doing to me? Why are you doing this to me? And to this day, they can bring tears to my eyes thinking about it. That's when I was 16 years old when that happened. And it haunts me to this day. Part of the thing going on here.
So what happened? Do you know?
So,
What happened to him?
they put him down.
Okay.
That's what they did at that time. There wasn't a no-kill shelter. They didn't take him and have him see a vet. They took him and put him into a chamber that sucked all the air out of the chamber, and
Yeah.
you know, he laid down and died. But I wasn't with him when that happened. And that, quit barking in the corner. That has haunted me my whole life. And I had a boxer. Her name was Roxy. She was a great dog. And
The dog least likely to make it to
Yeah.
an age, because she would escape and run
yeah,
and
she
not
was
pay
a
attention
runner.
to streets.
But when she died in my lap. You know, I was with her, she laid down, she put her head in my lap, and she died. And I was okay with that, you know, and she was okay with that. I knew it.
And
I couldn't.
I had an appointment to go see about getting a puppy because we'd lost the little guy, a little poodle that used to sleep. He found the right spot on my back that was just really good. And so I was gone. I get out of the car and I'm coming around and I hear Roxy, and I'd see the text that Roxy had just died. And I turn, and the next thing I saw was Neville, his face.
Yeah, and so those are the things. What you're saying is correct. How will you feel in 5 years? That's an understandable, because I have that regret with Spot to this day, and that's also why I say when Nemo goes, I just have to bring myself to get another dog to make me feel okay, because like I say, if I got a puppy, I think I'd die before the puppy would, you know, and I don't want that either. So
It sounds like you feel like you let Spot down, and you don't want to let Nemo down.
that's right. That's exactly what it was, is I felt like I let Spot down. I wasn't there for him. I let him go, and I thought I was doing the right thing.
You were young.
Yeah, I was young, and
And
even
apparently,
my dad said, well, where's Spot? And I explained it to him, and he actually kind of acted shocked, and then he said, well, okay, then that's okay, you know.
You've poured a lot of love and compassion into Nemo, and again, you have no idea what he is thinking, but I think that he cares about you, and you care about him, and
He takes a shower with me about every 2 weeks.
I don't think he'd feel like you let him down, because you're here.
Yeah.
You're talking about it. You're thinking about it. You want to make the right decision for him. This is all things that will eventually allow you to be at peace with your decision. I don't think you're ready today.
No, I'm not ready today.
So
I mean,
think about what we talked about.
If you had come in and said, listen, I think that he's ready, then I probably would have done that. I would have gone to your side and said, okay, I know that you see a lot more animals than I do.
Yeah.
But
I'll say this, he certainly struggles with a number of things. And what I see is not an accurate representation of how he's doing at home.
right.
You yourself said, like, he mostly just goes to his bed and sleeps. I carry him outside, I carry him up the stairs. Now speaking to you as a person,
Yeah.
if I had a dog and that is what was required of me, of that dog, I could not do it.
Yeah.
I could not. I think our lives are probably a bit different. I also have 2 young boys. So I could not do that. You know, but again, I'm not you. I think that the decision of quality of life is independent to So I think try to get that list and kind of just look at it every day and see like, is today a smiley face or a frowny face?
Yeah.
And I think that could help. And then
Yeah.
the other thing is it's okay to say goodbye when he's feeling good. So when
Yeah.
he does recognize you
Yeah.
and he's with you, he's in your arms. That story of another dog where they passed away in your arms, like that can happen here too.
Yeah.
In a way that's a bit more of a controllable way.
That's true, and I understand that. I
And-
can hold him.
Yeah.
We did
The
that
shot
with
is quick and it's effective, and it.
we did that with
I wish
Gazer.
There was a pill you could give them that they would just go to sleep and then they wouldn't wake up in the morning, you know.
He,
But
Eric Foster let us. We had a Australian Shepherd mix, and we were moving.
come here.
Hey, can I chat with you just for a quick second?
Anyway, we won't take up any more of your time.
Okay, just call if anything comes up, okay?
I will, and it may be in a week or two,
Okay.
but I appreciate you taking this time.
You're welcome.